Hello, I'm Terry. Welcome to my English class. Once you're abroad, whether pursuing your study or traveling, seeing a doctor may not be avoided. Therefore, having some basic understanding of how American clinics or hospitals work will be of great help to you, and it will definitely make your experience of seeing a doctor easier and more comfortable. As we all know, seeing a doctor in the United States will cost you a huge amount of money if you haven't had an insurance plan. If you are studying there, most schools will make you purchase medical insurance, which is absolutely necessary and good for you. So first, I'll give you some tips of purchasing medical insurance. To have a medical insurance, you need to pay attention to 4 figures: premium, co-pay for visits to doctor's office, drugs, and deductible. A monthly premium is the money that you pay each month for the insurance. Co-pay is the cost for each visit to the doctor's office. Drugs mean that you pay for your prescription drugs. A deductible is the sum of money you pay when you are hospitalized. There are several student health insurance plans which are quite the same, but with different premiums and deductibles to meet different demands. Basically, there are 3. Let's name them Plan A, B, and C. Plan A. Your premium, for example, is $100 per month. You'll pay $30 for each visit at the doctor's office, $20 for each prescription, and $5,000 for deductible. Plan B. Your monthly premium will be $240, but you'll have $0 for deductible, $5 for visits, and $0 for prescription drugs. Plan C. You pay $140 for the monthly premium, $15 for visits, $5 for prescription, and $1,500 deductible. Comparing the 3, Plan C would be a good choice. As a student, you can go to the health center in your school if you are ill. The doctors there are general practice physicians or primary care physicians who deal with all the ordinary types of illnesses. You'll need their referral to specialized care of serious diseases. Don't forget to make an appointment with the doctor beforehand. Here are several more words for you besides general practice physicians or primary care physicians, as I mentioned above. Physicians, surgeons, dentists, outpatient, and inpatient. If you are traveling abroad, you haven't had any kinds of insurance, and you can't get a family doctor, you can try urgent care center or hospital emergency room. However, if you have options, avoid emergency rooms unless you have a broken bone or life-threatening medical emergency, because the costs there are astonishingly high. Private clinics are relatively cheaper and convenient. Now that we've learned something about insurance and doctors in the United States, next, let's recall the expressions of some common illnesses that you've learned before and learn some more common diseases as well. First, all kinds of aches: headache, stomachache, toothache, backache, etc. Then, cold and its symptoms: cough, fever, sore throat, running nose. Others: ear or eye infection, small cuts and cuts that may need stitches, broken bones or fractures, sprains and strains, vomiting, diarrhea, chest pain, bleeding. However, the most useful expression for you would be, there is something wrong with my... Well, have you remembered all these expressions? Now, let's make an appointment and go to see a doctor. Suppose you have had a severe cold. Usually, you'll meet with 3 people in the clinic: receptionist, nurse, and the doctor. First, you need to check in and register your information on a computer with the guidance of the receptionist. Then, you wait at the waiting room until a nurse comes to you, who will inquire about symptoms of your illness and do some routine diagnosing. For example, measuring your height, weight, blood pressure, and taking your temperature, etc. Finally, it's time for you to see the doctor. D for doctor and P for you.
Good morning, I'm Dr. Elton. So you've got a fever and a sore throat.
Yes, Dr. Elton, and I'm having a runny nose.
Okay, when did it start?
About 2 days ago.
Open your mouth, please. Dr. Elton uses a tongue depressor to press your tongue and examines your throat. You have infection. He then presses a stethoscope to your chest and your back. Now take a deep breath. Nothing serious, just a cold. Here's your prescription. Get your medicine at any pharmacy and take the medicine according to the direction.
What is pharmacy? Where is it? Can I get my medicine here?
Oh, pharmacy is where you can get prescription drugs. You can find one almost everywhere. There are a lot of pharmacies like CVS or Walgreens, the 2 most common ones in America. There are also pharmacies in supermarkets like Walmart.
I see. Thank you, Dr. Elton.
Hope you get better soon. Don't forget to drink a lot of water.
Well, if you have had your insurance plan, and if it is Plan C, as I mentioned, the best choice for you, how much are you supposed to pay? Yes, $15 for visits and $5 for prescription. So, you'll pay the doctor $15 for the visit and pay $5 for the medicine at the drugstore. Finally, please remember 2 kinds of drugs: prescription drug and over-the-counter drug, OTC. Apart from taking medicine, having an injection or getting an IV drip is also another common way of treatment. Well, we've talked about how to see a doctor in the United States today. Here are 2 assignments for you. Task 1. Please recite all the important words, phrases, and the dialogue that we learned today. I'll check that in class. Task 2. Make up a dialogue between doctor and a patient with a partner and role play it. This is Terry. Hope you enjoyed today's lesson. I'll see you next time.